Okay, well, it is 12:02. Welcome, everybody. We're going to talk today a little bit about how to really dive down into the specifics of what the clients will need for their plans. So before we do that, let me go ahead and just recap what page one is, so you get the general gist and what the client should get out of your session when you do page one, right? So in general, there's two parts of Medicare, Part A and Part B. A is anything that's overnight, hospitalization, skilled nursing, et cetera, where they don't come home in the same day. Generally, that's Part A services. Part B is anything that's same day. So doctor visits, x-rays, MRIs, same day surgeries, any of that stuff is covered under Part B. If you look down at the bottom of the sheet, it talks about the cost. The net of what you should have them understand is Medicare by itself is horrible. It's bad coverage. So we have to fix it. And we can do that one of two ways. And you can see on the diagram here, you can either go down, which is a prepaid version of fixing it. They're going to get a Medicare supplement. The goal of the Medicare supplement is to eliminate all the cost. The only gaps they'll have at this point, if they do a Part C or not C, a Plan G or Plan N, would be the Part B deductible, which is the $233, and then whatever copays they have for drugs. Everything else is covered, right? Then they have to get a drug coverage plan. In general, they're about $50 a month. Now, these prices will fluctuate a little bit based on where you're at, what kind of exact coverage you give them, but in general, it's a pretty solid cost structure. So I look at $3,000 a year versus, do we want to go the other pathway, which is a pay-as-you-go pathway? And that's Medicare Advantage. What Medicare Advantage does is it takes Part A and B coverage and adds drug coverage and combines it through a private insurance company, a United or Humana, Aetna, whoever. And then they give you an option of what type of plan you want to get into. Do you want an HMO, which is network-based? If you look at my little blue box there, you can see the doctors, hospitals, specialist surgeries, all that stuff have to be inside of network. A PPO is network-based as well. However, in a PPO, you have an option to go outside of network. The difference between HMO and PPO is very, very simple. They're both network-based. The PPO gives you flexibility to get outside of the network. And then the PPO, you're going to pay a little bit more for each of your services for that flexibility. Okay. So that's the overall gist of what the client should get in page one. If you go back into the training I did for that, you'll see we want to slow that down a little bit, make sure they understand that, go over the cost, and really emphasize how bad original Medicare is. But overall, that's what they should get of page one. Now, transitioning into page two, and I call this 4 pages. It really turns into 3. But pages 2 and 3 really are a breakdown of what their services look like. So, Brian, are you available to talk with me now?
Yes, sir.
Excellent. So we want to use you as our client today. If there's anything you don't feel comfortable disclosing, that's fine. But I would prefer you not to exaggerate anything. I would like you to say, when I ask questions, something either realistic or something that's close to what your actual situation is. Okay. So let me ask you this. Do you have a primary doctor, a primary care physician?
I do.
Okay. Normally, I would ask you what the name of that doctor is. I'm going to do that because what I want to do is I want to make sure that I have that listed, because later on, when I go into sales or when I go into Sunfire, I'm going to look that doctor up to make sure that I keep you with that doctor.
Dr. Bawadi.
Say again?
Dr. Bawadi.
Dr. Bawadi. Okay. Now, how long have you been seeing Dr. Bawadi?
Probably 8 years.
8 years. So it's pretty solid foundation there. It's not something that you probably want to get rid of, correct?
Correct.
Okay. So you can see the importance of making sure that we identify that primary care physician, because in Brian's case, if we decided to find a plan that does not work with Dr. Bellotti, he's probably going to be pretty upset with us, right? So the first thing we want to do is identify the primary physician. and make sure we understand what the relationship is. If it's somebody where I just moved in, I don't really have a relationship with that doctor, well, let me ask you this, patient. Do you mind finding a different primary if I find a plan that's less expensive for you, or do you feel pretty well established with that doctor and want to stay there, right? That's the first thing we need to identify. So once we identify the primary doctor, then we need to go to the specialist, right? So Brian, how many specialists do you see currently? What types of specialists do you see?
I see a podiatrist.
Okay.
I was seeing an oncologist, but no longer. So two.
Two. Okay. So would it be fair to say that you probably see them quarterly?
Oops, my internet was just unstable there for a second. Sorry, I missed that.
No worries. Would it be fair to say that you see each of those specialists every quarter?
Oh, shoot. I don't know what the heck. So sorry. I don't know why my internet is messing up on me.
Can you hear me okay now?
Oh, you did ask for it to be realistic.
I did. Technology problems in the 21st century. All right. Brian, can you hear me now? Okay. For the sake of training, Glenn, can you speak with me?
Yes, sir.
Let's switch gears. Let's use you, if that's okay.
Yeah, it's fine.
Perfect. All right. Do you see specialist?
Oh, no.
I'm sorry?
No, I do not.
You do not. Okay. So in a situation like this, where a client does not see specialist, what I'm going to do is recommend using the national average. Okay. The national average is, ironically, 2 specialists that they see every quarter. Okay. Which turns into 8 visits per year. So I'm not going to be able to type in the different numbers in here today, but if you guys had this and you were able to write this out, so if you get a copy, you want to print it out, whatever, the numbers that I'm going to show you will be the national average, right? Now, Glenn, were you in the hospital at all last year?
No.
No. And just an agent trick, I already knew that because you don't see any specialists. If you had specialists, you might have been in the hospital, but if you're in a hospital, you definitely would have a specialist visit because you would have a follow-up, right? So just tricks of the trade here. Do you have any upcoming surgeries that are planned?
No, I do not.
Okay. Again, I knew that answer because you don't see any specialists, and specialists would normally be the one to let me know that. Okay. So what I'm going to do, Glenn, is I want to give you a fair comparison between HMOs, PPOs, and supplements. You're probably going to be a little bit less than the average because you don't see any specialists, you haven't been in the hospital, you don't have any upcoming surgeries, and I would assume from that you're fairly healthy, right? Now, the normal person would see their primary doctor every quarter, so that's 4 visits a year. And I'd like to throw an extra one in there. There's been all kinds of things like COVID or the flu or whatever. So I like to put in 5 visits just to kind of give a round number that's realistic. Okay, so would you say that's fair?
Yes.
Okay, so 5 visits. Now, the neat thing about an HMO is a preventative plan, right? We talked a little bit about that when we were talking about page 1. But HMO is a preventative plan. That means that the doctor's goal is to keep you out of the hospital, to keep you as healthy as possible. So on an HMO plan, generally, they're not going to charge you to see your primary care physician. So those 5 visits have no cost. Pretty cool, huh?
Right.
Now, specialists will range, but on average, they're about $25 a visit, right? So if we did 8 visits, which is 2 visits to each of the, 4 visits. Yes, Lucian. So we got 8 visits at $25. I believe that turns into $200, right? So 200 for specialist. We've got hospitalization. Now you said you haven't been in a hospital, but I like to give fair assessment and just in case scenarios. So I give you a fair cost just in case something happens. So let's put you in a hospital for one day and what that would cost. On average, HMOs are going to be about $200 per day, and they will have a cap to them. We'll talk about that a little bit later when we get into the next page. But one day in the hospital, let's say it costs you $200. And then if you had surgeries, I would go ahead and put this in there. But since you have nothing upcoming, we could probably skip that. But if you want, I can put that cost in there. But an average surgery is about $150 on an HMO, give or take a little bit. Okay. So when I look at an HMO, with your usage, you're not paying anything for primary care. You're not seeing any specialists. So you're actually saving that $200 for the specialist visits fee. You probably won't end up in the hospital. So that's another $200 you're saving. You don't have any upcoming surgeries, but just for the sake of comparison, I'm going to go ahead and put $550 annually that you would have spent on an HMO based on your health. And we know that's high because you don't see the specialist, you're not going to the hospital, you're not having surgeries. Okay. But just so we have a good comparison, if you catch up with the rest of the nation for people over 65, then that's about what you would pay with that type of usage. Okay. Now let's switch over to PPO for a second. PPOs are not necessarily preventative, but they are cost effective and they allow you more access, right? So when we look at primary care, they're not going to charge you an arm and a leg to go there. They're going to charge you $10, $20 for each visit. And it'll be inexpensive. So if we took those same 5 visits at $20, we'll go on the high side. That's $100 for the year. Okay. A day in the hospital, specialist, it can range. I would say the average is about $50 per visit. So that's double what we had for the HMO. So instead of 200, we're going to use 400. Day in the hospital is a little bit more. It's about $300 per day. And then you're probably in the same range for the surgeries. So if we did that same structure, and again, you'd be a lot less than this. You'd be more in the $100 range if you got to all 5 appointments for your primary. But the average senior is going to spend $950 for the year. Okay. Now the supplement we already talked about. The supplement prepays everything, right? So on a med sup, we already know that we're spending $3,000. Does that make sense so far? Mm-hmm. So we have an HMO that's least expensive, and in your case, very inexpensive. You will have minimal cost. You have a PPO that's going to cost you a little bit more. And then you have a Medicare supplement that when you go there, you just show them the card. Once you satisfy that first deductible, you don't worry about anything else. In your particular situation, I would think that if we're trying to find a plan that sees you, that you can still see your doctor, primary care, and still give you access to the things you need, we probably want to look at financial next, right? Would you agree with that?
Yeah.
Okay. So for me, in my vision of this, and you can tell me if I'm wrong, I think an HMO is probably the way to go, just looking at the basic numbers.
Yeah.
Okay.
I'm going to agree with that.
So let's go ahead and move on to page 3 then. So let's look at what 5 years would look like. And I'm going to give you a couple of scenarios that are kind of like worst case. Okay. So if we took an HMO, we know we start at $550 a year. That's where you're at now. And of course, that's escalated numbers. But if we took that times, actually, let's break this down by year for the first 5 years. So 550, we'll do that. You're really no usage for the first 3 years. But on year 4, what happens is you have a catastrophic year. You have a heart attack. While you're having a heart attack, you fall down and break your leg. You end up in a hospital for a month, and then you're in skilled nursing for 6 weeks on top of that. And then you've got all kinds of specialists and stuff you've got to see, and you just have a horrendous year. Well, inside of HMO plans, they have what they call a maximum out of pocket. Okay, so year 1, we'll do 550, year 2, 550, year 3, we'll do 550. Year 4, you've hit the maximum out of pocket. So what happens is you've got all this catastrophic stuff happening. At some point, the plan says, you don't have to pay anymore, Glenn. We're going to take everything above this dollar amount. Okay. So on an average HMO, let's say, and I'm going to use a higher number. There's a lot of plans that use lower than this number, but I'm going to say 6,700 is your maximum out of pocket. Okay. And then on the 5th year, just to be fair, because if you've gone to the hospital and you had all that crazy stuff happening, you're going to have some more specialist visits, right? So instead of the 550, which is the average, I'm going to double that for the 5th year, which is $1,100. And let's see what we come up with. Let's see, that's 11, 22, 8. My goodness, I should have done this easier. 22 and 67. 989. Let's just go ahead and call that 9,500. It's a little bit less than that, but just for ease of use. Okay. So in 5 years on an HMO, even with a catastrophic year and a year following that to absorb additional specialist visits, maybe some rehab, things like that, we're at 9,500. Okay. And on a PPO, we'll use the same scenario, right? First 3 years, everything's good, right? We're spending about actually, we'll just do 1,000 to make it easy. $1,000, $1,000, $1,000. And then same thing happens. You have a catastrophic year. You hit that 6,700 maximum out of pocket. And then on year 2, or I'm sorry, year 5, we'll do 2,000, which is double your normal usage, right? That will account for your specialist visits and all that other usage. So in this scenario, 2, 3, 4, 5, we'll go ahead and just make it easy and call it 12,000. Okay. Where on a med sup on 5 years, 3 times 5 is 15, right? So 15,000 for Medicare supplement. So we can see, even on a long year plan, even with catastrophic year and a year with double usage, which in your case right now, you're not even using that, it still looks like an HMO or a PPO would be a good fit for you. Are you agreeing with that?
Yes.
Okay. So the way I see that is, if we extend that one more time, let's do the next 5 years. And let's say you have a good 5 years, right? 550 times 3, no, times 5, what was that, 2,500? No. Let's just call it $3,000. So another $3,000 on top of that. So let's call that 12,500 for HMO for 10 years. Another 5 on top of the 12 for your PPO, that's 17,000. And then 10 times 3 for the supplement is 30,000. So by my calculations, and again, your usage is way under this right now, I end up with an HMO in a 10-year period with a catastrophic year and a year following that that's horrible. And given that you're not even using as much as the average, worst case scenario is you're about 12,500 in 10 years. In a PPO, you'd be about 17,000 in the same scenario. And a Medicare supplement, you'd be about $30,000. So the way I look at this is, I'm really leaning toward one of the Medicare Advantage plans for you, because your usage is much less than that, right? It doesn't, for me, being an agent who's trying to be conscious of your finances, it doesn't make a lot of sense on my side to offer you a Medicare supplement unless that's something you want me to do. Make sense?
Yeah.
Okay. So one of the things that I want to do now is let's identify who your specialists are, right? So I know you don't have specialists, but we're going back into training mode here. So we want to get the specialist names, right? So we already have the primary care physician name. We want the specialist name. And then, are you taking any prescriptions right now, right? If they're taking prescriptions, we want to document what those prescriptions are. And then normally what I would do is I would roll right into page 4, right? Page 4 is drug coverage, and it talks about how drug coverage works in general for Medicare. Okay. What I will say in my experience is, most people, whether they get a standalone drug coverage plan or they get a plan that's built into a Medicare Advantage plan, Drug coverage is going to be pretty similar. And if they're going to have high usage, it really is not going to matter because they're going to hit the donut hole at the same time regardless. And they're going to come out of the donut hole at the same time regardless. So when we get into page 4, which will be a couple weeks from now, we'll talk about that a little bit more specifically. But for today's training, the goal, what we want to do on this side of things is just document their medicines. And what that does is it's also a circle back just to make sure that they don't see any specialists. So if I have a client that says, well, I do take a high blood pressure pill, or I take a Zoloft. Okay, who prescribes those to you, right? Oh, my psychiatrist does the Zoloft. Okay, well, that's a specialist. So we need to make sure we get that specialist name in there, right? Or my high blood pressure or cholesterol medicine. Is that a cardiologist that prescribes that to you? Oh, that's right. Yeah, I do. I see Dr. Okay, so I don't really necessarily need to see the prescriptions per se, but if I'm really trying to do my due diligence with the patient, I want to make sure that I'm identifying all the doctors, right? And one of the ways to do that is to ask the medicines and circle back and ask who prescribes that, and just make sure that they've identified that for you. Okay. So what's the goal of pages 2 and 3, right? We talked about page 1. What we want to do is help them understand the concept is to, 1, know that Medicare by itself is horrible coverage, and it doesn't include drug coverage at all. The second thing from page 1 we want to have them understand is they have 2 pathways they can go down. They can prepay Medicare Supplement, or they can pay as you go Medicare Advantage. And then when we get into pages 2 and 3 here, we want to really kind of dive into their personal situation. You notice I didn't really veer too far away from the national average, even with Glenn, who really had no usage, right? Because what happens in a year or two when they start having to go to a cardiologist or a neurologist or whatever, right? We want to give them numbers like this. And in my opinion, you should do this 4 pages with every client you do and give them a copy of this page 2. This answers questions for them for years to come, right? How did we get to this plan? Well, we looked at the cost. We identified the different doctors you see. We made sure they were in the plan. And then we tried to find the plan that gave you the cheapest way to access all the services that you need. Okay. So what happens when a patient is what I consider, again, there's probably a better term for this, but a train wreck. Okay. What if they go to 8 specialists and they have 24 visits a year, and they're in and out of the hospital, and they have 4 or 5 surgeries coming up, right? You can see $3,000 is kind of the benchmark, right? Anything above $3,000 for a year, they should just get into a Medicare supplement. It's going to make their life so much easier, and it's going to cut off about $3,700 worth of risk. So if Glenn said, you know what, Carl, I'm pretty bad off, man. I've got a specialist visit every day this week, and it's like that every month. And I've got a back surgery coming up, which is going to cause a bunch of rehab, and I've got a whole bunch of all these things that's going on. My mindset is going to shift from, okay, managed care, let the primary kind of help him through that, to let's make sure you've got coverage that's going to go anywhere, which is Medicare Supplement, and it's going to cost you the least in the long run, right? Again, Medicare Supplement, because there's so many different copays that they anticipate having for that next year. So these 2 pages really help identify where they should go at the current moment. And page 3 really helps to identify the long-term effects of that. Now, that same train wreck, right? Let's say that they're going into this year and they've just got a ton of stuff that's happening. It doesn't mean they're locked into that plan forever, okay? So what I will tell somebody that I'd put on a Medicare supplement is once we get to a point where your usage kind of calms down a little bit and it makes more sense for you to go to an HMO or a PPO, then we'll get back together and we'll find a plan that better suits you. Because what the goal of the doctors will be is to get you to a stable place, right? I've had a lot of people, I've got a good friend of mine who's got stage 4 pancreatic cancer. And he is on a PPO plan because it's more cost effective and it serves all his needs. Plus he gets the additional benefits. So just because they start on a Medicare supplement doesn't mean they need to stay there. And the same is true for Medicare Advantage. However, I will say that when somebody gets onto a Medicare Advantage, after the first year, they have to be medically reviewed to go into a Medicare supplement. So that is one thing that we always want to identify with the clients, is that none of this is a one and done. You want to try to create a rapport with the client so that they reach out to you anytime their status changes, the doctor's changes, anytime their health changes, medications, things like that, because you want to be the first point of contact. The reason that is if you are not the first point of contact, some other agent's going to come back behind you and steal your business. I've seen it so many times, right? You have somebody that goes to visit a senior center, says, hey guys, I'm just here to do an educational event, which by the way is one of the other trainings that I teach you to do. And I'll be here after if you have any questions. Oh, great. Hi, I'm Jane. I've got Medicare, I've got an agent. He's got me on a good plan. Okay, great. We want to do a quick needs analysis. Has anything changed since you met with him? Well, actually, yeah, I've got a different specialist and see, now you got problems, right? Because that agent's job is to make money. And that agent is going to do whatever they can to flip their business into their pocket instead of yours. So the goal out of all these 4 pages, and you'll hear me say this time and time again, is to build rapport with the client. You always want to come back to reach out to me if you have any problems, reach out to me if you have any questions, if anything changes, I'm your point of contact. If you have any problems with the insurance company, call me. I might not be able to help, but I want you to call me first because I might. If you have problems scheduling things with your doctor's office, call me. Maybe I can intervene and work on your behalf. Okay. So did a lot of talking there, about 30 minutes worth. What questions do we have on page 1, 2, or 3?
I have a question, Curtis.
Go ahead.
Don't you have to include in the equation the Part B premium, which they're responsible for, the $164.90 times 12 months, which is $1,800?
Okay, so let me flip that question back to you. So if somebody goes on Medicare supplement, do they still have to pay the Part B premium?
Yes, I do.
So if they go on a Medicare Advantage, do they still have to pay the Part B premium?
Yes, I do.
Okay, so what I do, and again, we kind of skipped through page 1 very quickly today because I did this 2 weeks ago. However, can you guys see the page 1 now, or are you still seeing page 2 and 3?
2 and 3.
And 3.
Give me 1 second. Still trying to figure out Zoom. And to answer somebody's question I saw in the chat just a second ago, how can we give these pages out? These pages will be available if they're not already on there on the Better website. You can pull these down. If you need a specific copy, you're welcome to shoot me an email. I'll send you all 4 pages. But what I recommend is building yourself a little portfolio folder, if you will, and having all 4 pages every time you see a client. That way you give them the whole 4 pages, right? This is client Jane Doe. Jane, when we go through pages 2 and 3, these are your personal numbers, right? If they change, you're calling me, right? So, but Roberto, to answer your question, when I go through the slower version, right? When I go through the actual client version of page 1, I identify that Part A has already been paid for by FICA taxes, unless they have not reached their 40 quarters. And then Part B, you can see right there, there's a cost of 171.10. That is before they make any of their decisions, right? So regardless of what choices they make, we have to let them know that they're paying that 171.10 regardless. Even if they stay on original Medicare, they're paying 171.10,
Yes,
right? That's the new rate. Let me put my email in the
Yeah,
chat
it
here.
actually went down in 20 is once 160. And the deductible went down to 226
Where are you getting those numbers
from the CMS website. Part B is 164.90 and the deductible is 226. They both went down.
I will verify that. The last numbers I have, which are printed in the marketing books, are 171 and 223.
I just something and drop you off. I would. Hello.
Okay. Right, my email. Let me just check my email. I might have two ends in mine. Somebody is doing some fun stuff there with their microphone. So if you got other stuff happening, please mute yourself. Okay. Roberto, excellent question. But yes, I do identify it on the front side and make sure that they understand that regardless of what we do with them today, that whatever, the Part B premium is going to be their responsible regardless. Now, it also generates another question. If they start to balk at that, I start asking questions about income and things like that. We're going to do a separate training on dual eligible D-SNPs in combination with C-SNPs. So we'll get into that on another training, but yes, definitely something I address. Okay, Deandra, you have a question.
Yes, hi, good afternoon. So based off your training, I'm all new to this. I didn't catch the first part of your training. But you're saying that even if they go with an advantage plan and they're in good shape for the first year, right? And in the middle of the year, they have an accident and they start seeing all kind of specialists and hospital visits and all of that stuff. You said there is a cutoff as to how much they can spend out of pocket.
Correct. Yeah, so there'll be a maximum out of pocket. Matter of fact, let me go ahead and pull up any plan. I'm sure I've got one somewhere. See if I can just find a plan I can look at real quick. Matter of fact, Deandra, what's your zip code?
It's 33463.
Okay, let's do this. Now, you guys can play with a couple of different websites. I like to use Medicare.gov. You can use Sunfire to do the same thing. I'm going to go ahead and share this screen with you instead, though. So this is Medicare.gov, right? Now, if you want to get an idea of how these plans look, you can either do it through Sunfire, which I believe I posted the training again in the LBA chat. But we will also have a specific Sunfire training on not 2 weeks from today, but 4 weeks from today. Network Insurance will be doing Sunfire training specifically for you guys at 12 o'clock. So you can do this. You can go and find plans. And give me your zip code one more time,
463.
Okay, and I want to look at Medicare Advantage, right? And for this, I'm just going to go ahead and say I don't get any help. I don't want to look at that right now because that's not what I'm looking for. So I can look at all the different plans that are here, right? HealthSun and Humana, Freedom, Cigna. right? You got all these different plans. So in any of these, you see right here on the main page, 2,700 maximum you pay for health services, called MOOP, maximum out of pocket. Each one of these has a MOOP.
Mm.
Okay, so in a scenario where the maximum out of pocket is only $1,000, if their doctors fit inside that plan, why would I ever put them on a Medicare supplement?
Okay.
Right? It's $2,000 they're spending in addition to a worst case scenario for them. Does that make sense?
Yeah, it makes
So
sense.
that's why it's important to kind of understand how the plans work. I highly encourage you guys to go into either Medicare.gov, which is where we're at right now, free to use. Go in there, you can play with it all day long, right? You can go into Sunfire and do the same thing. Sunfire is our quoting tool that we use that allows you to quote and then also enroll, right? They're both great portals. Both of them are set up pretty similar so that you can see. Medicare.gov is just something I've been using for years. I haven't used Sunfire for years. So I'm very used to this. I can tell you how to get in and out and everywhere in here. So the one downside to using Medicare.gov is you see this nice little enroll button. Don't hit that because then you won't get credit for it. You've got to go back to Sunfire to get credit for that sale. Okay, so if you are going to use Medicare.gov, only use it for informational purposes. Always go back to Sunfire for enrollment.
Curtis, you see the
And it's,
bill-
yeah,
the monthly premium, you see the 164.90?
before. Yeah, I was looking at
Gotcha,
that too.
164.90. Gotcha. Awesome. I will update my page.
Yeah, and
one.
the deductible is 226 for Part B on the Med Sup.
Okay, I will update those numbers. Great catch. Thank you. All right. Carl at Legacy.
And all these plans that's on Medicare.gov, we have access to them on Sunfire.
Say that one more time.
All these plans that we're seeing on this website, do we have access to them on Sunfire?
Yeah, so Sunfire basically pulls from Medicare.gov. Is how that works. It's just a portal. I'll leave it at that. Yes.
Okay.
Okay. Let me. Put my correct email in the chat there for you guys. Okay, what other questions do we have while I'm doing that?
I just joined the group a week ago, Curtis, Ryan's team. So I'm doing the credentialing now for Aetna, and I'm still pending WellCare, United, and Humana.
Can I show you the Sunfire? Let me see if I can do that. Which, by the way, let me introduce myself. I probably should have done this at the beginning. My name is Carl Judd. I am the national trainer. The reason you see Curtis is because we share the Zoom login, and I'm just too lazy to go in there and change the name every time. So, and I don't want to create problems for Curtis when he logs in. So, my name is Carl Judd. Matter of fact, that's my email. And this is my mobile number. I give that out to you guys in case one of two things happens. Either you get into a sale, you get in a bind, you don't know what to do. You can reach me out in an emergency situation. Best thing to do is text. Or if you need some more training, or if you're a group leader and you need training for your group, you can reach out to me and I will provide training. I've got a training this Saturday, a matter of fact, for a group of individuals to teach them some stuff. So let me see if I can get into Sunfire real quick. Try not to pull too much off of my phone. My building lost internet today, so I'm off of my hotspot. So I'm doing my best not to overload my phone here.
Carl, quick question. Do we get business cards or no? We have to go get your own.
You'll have to talk to your upline about that. I would say that, so I have my own agency as well, right? I generally ask my agents to go ahead and get their own cards.
Yeah.
And one of the reasons I do that is because I want to make sure that they put on there what they want, right? So if you're doing just Medicare, you want to put Medicare specialist. If you're doing life, health, annuities, you might be an insurance specialist, you know? So I generally allow the agents to kind of do what they want. I don't usually take care of that. Okay, that's not Sunfire. Okay, so let me address that question. So Gurley's addressing one of the great questions that we always come across, right? I'm going to show you guys Sunfire here, right? So this is Sunfire. You can get into quote and enroll, and we'll use was it 33463? Now I can see Medicare Advantage, I can see Part D, MedSups, all kinds of stuff. Now the Medicare Advantage there versus the Medicare / Part D, sometimes you'll find Medicare Advantage without drug coverage. I highly discourage you from setting people up on that unless they go to the VA for their drugs, or you find a situation where it just doesn't make sense for them to have drug coverage. And it doesn't mean that they don't take drugs. It means that they have gone a number of years without drug coverage, and the penalty for having not had drug coverage outweighs the benefit of having drug coverage. Okay, that's really the only 2 times I would put somebody on a Medicare Advantage without drug coverage. Okay, but here's Sunfire. If you're doing medications, I'm just going to go through this quickly because you're going to have specialized training in this later, right? What's most important to you? You can click whatever you want to, but you can also, like here, are there any doctors that's important? Yes, I want to click those doctors in, right? It's going to let you know what doctors accept the plan, what don't, okay? And we keep going down, blah, blah. I don't know anything. Don't get extra help. I want to view all plans. And so just like Medicare.gov, you're going to see plans. Now, the difference that you're going to see here is what I'm contracted with will show up here. What I'm not contracted with will not show up here. Okay. The only exception to that, in Gurley, you folks out there in California probably will experience this once we have the Kaiser Presidente appointment, since that will not come through network insurance. That will be a one-off plan. So for you guys, you might need to use Medicare.gov to get the quoting and then submit it through Kaiser. There'll be some plans in certain areas that are like that. Care and Care in Texas. Shoot, I forget the name of there's one in Alabama, Birmingham area that's like that. But every once in a while in the larger areas, you'll find like little one-off plans that are not part of the big group here. And that's the only time where Medicare.gov will show you that plan that you may be contracted for versus the Sunfire app that shows you what you are contracted for. So ease of use, generally, I recommend just go ahead and go through Sunfire. That way, if you find the plan that you want, you just go right over here to the enroll button and get them signed up, right? But outside of that, you can use Medicare.gov to see the overall plans. But just keep in mind it will show you plans that you are not certified to sell. And sometimes if you're in front of a client or if you're doing a Zoom and sharing your screen, that can create some problems, right? So have a little modesty when you use Medicare.gov.
One question, Curtis.
Carlos.
In the top part that says Cigna True Choice Medicare, it says 3,200 in network and 5,100 combined. What does that 5,100 mean?
Okay, so let's look at these two plans, right? You've got Cigna HMO, 3,100, it's in network. Remember, an HMO is network only. You cannot go out of the network. On a PPO, which is what this is, there we go. You have two different maximum out of pockets. 3,200 is if they stayed in network. If all their services were in network, their max is 3,200. Anything above that, Cigna is paying for. Now, if they go outside of network, it increases to 5,100.
Okay,
Does that make sense?
yes.
Okay. And you'll find that any PPO, I'm sure United or somebody's going to be on this down here somewhere. Let's see. What area are you in?
Lake Worth, Florida.
Okay, you might not have, no, you should still have United down there. Oh, I know why. This login doesn't have United. So you're not actually seeing everything. But if this login had all the certifications, you would see United Healthcare that has the same thing. You'd have a 6,700, 10,000. For the HMO, it'd just be one number. I think it's 5,900 or 3,900, something like that. But again, you can always, if you want to be super diligent, you can always go back to Medicare.gov and check the two. The numbers should be the same because Sunfire pulls from Medicare.gov. They just try to make it easier and put it all in one place. You also have features that you can use on here that you don't have available on Medicare.gov. For example, you can look at just 5-star ratings. You can look at plans that just do a Part B give back. So if you're not familiar with a Part B give back, what that does is that $164.90 that is paid for their Part B, some or all of that can be put back into their Social Security check. So some areas have things like that. Some don't. So you can filter through Sunfire a little bit better than you can with Medicare.gov. The other thing that's really nice about Sunfire is as you're going through those questions, one of the things that I find super advantageous is that you can put the doctors in there. And if the doctors are not there, you don't have to worry about that plan. Or you can have the conversation with the client, you know, is it more important to put you into a plan that is more expensive so you can see your doctor, or do we want to shift you into this lower expensive plan, but we have to find you different doctors? We will find that a lot with specialists. Okay, maybe not so much with primary. There's usually plans that primaries take, but I think you'll find that with specialists, sometimes that can be a challenge, especially if there's 5 or 6 or 7 specialists that somebody sees. Generally, I'm trying to push them toward a PPO versus an HMO, just for ease of use. Okay, what other questions do we have? Well, you guys make me feel like I'm doing a dynamite job here. Hardly any questions. Okay.
I have a quick question. Sorry.
Yep. Go ahead.
What was the give back thing? You said it gives it back to them, so it's like they're not paying it, or?
Right. Yeah. So let me see if I can find. Give me one second. I'm going to get into an area where I know they have a buyback, so I can show you what that looks like. You guys probably can't see the screen yet, so let me- It's not what I want to share. You guys can see the Medicare.gov site on the share, correct? Okay.
Yep.
All right. So again, we're just going to do this quickly because we don't want to care about anything except for the buyback. So I'm just going to go quickly through this, right? Filter that.
Simply Extra has a give back.
Is it simply?
Yeah.
That's Jacksonville, Florida area. and,
Oh, Jackson. Okay.
I haven't worked there for a couple of years, so I know there's buybacks there. Okay, so see how it says Part B premium reduction. So what that is a reduction of their Part B. So how that works is the plan. So you understand the big concept of what happens when you submit an enrollment. The enrollment goes to the insurance carrier. So in this case, it would be Simply. Simply documents that, they send it up to Medicare for approval. So anything that's happening inside the plan has to be approved by Big Medicare and then shot back down to Simply for approval. Okay, so in this particular plan, they reduce the member's Part B premium by a certain dollar amount. I'm not sure if it tells you in here, but most likely it'll be close to the full 160 something. I don't see it in here. Yep, that's not nice.
Is their premium paid just one time, or is it paid
No.
like every time?
So as long as they're on the plan, starting the effective date. So let's say you get somebody who joins Medicare and their effective date is March 1st. You submit the applications now, right? And March 1st, they become effective for the plan. In theory, they will get the 164.90 back into their Social Security check starting March 1st. Now, I will say when it's not open enrollment or a normal enrollment period, it can take up to 90 days for members to get their Part B premium back to them. But it will be effective from the effective date of the policy. So let's say it takes until June for the policy to catch up. They'll actually get the 164 for March, April, and May, and June on one check. And then going forward, as long as they stay on that plan, they'll get the Part B reduction going forward. So if I sign somebody up outside of a normal enrollment period or outside of their initial sign up for a Medicare election when they first turn 65, I let them know it might take a little bit longer for their Part B to come back to them, but they will get the 100% from when it started, even if it's a month or 2 months late. Okay. Any other questions on pages 1, 2, or 3? Okay, so let me just do a quick recap. Page 1, big thing to do. Make sure they understand, one, Medicare coverage by itself is horrible, right? They've got 2 options. They can go through a prepaid path, Medicare Supplement. If they're high usage, that's going to be the way to go. Keep their costs down, right? Limit it to $3,000. If they're pretty stable or an average user, or like Glenn, barely any usage, right? Medicare Advantage sounds great. They're saving a lot of money every year. Plus, they're getting additional benefits. They get their drug coverage included for free, probably get a silver scripts, or I'm not silver scripts, silver sneakers, or some kind of fitness benefit. A lot of plans are given all kinds of other stuff like grocery cards and over-the-counter cards and all kinds of other stuff that's built into these plans. So Medicare Advantage can be very attractive to people who don't have super high usage, right? So again, do we want to go down the prepaid path, get a Medicare supplement, forget about it? Or do we want to go through Medicare Advantage and then pay for services only when they're having them done, right? If they go through Medicare Advantage, HMO or PPO. HMO, you have to stay in network. PPO, pay a little bit more, but you can go out of network, right? That's very simply what they need to understand from page 1. Page 2 and 3 is really more of an individual approach to your specific client. This is what your usage looks like. This is what a worst case scenario would look like within 5 years. And what's overall in 10 years, what it should look like for you. Okay. Now, when we come back together, when you see me again, which will be in 6 weeks, I will go through page 4. Page 4 is all about drug coverage. The way I try to teach you is simple, but I will not shy away from the fact that drug coverage is very confusing, not just for the patients, but for us as well. So I will do my best when we get together and do page 4 to explain it to you. We'll go through it. It only takes me about 5 minutes to teach it, but we're going to take the whole hour to dissect it. Okay, so when we come back together for that, be prepared to ask a lot of questions. There is no dumb questions when it comes to that, because it's very important for you to understand the concept of drug coverage and to do it in a way that's compliant for your client. I'll wrap up this session by saying this. These 4 pages that I teach you guys, if you were to get secret shopped, right? And if you haven't heard that word before, understand that that's a reality. If you do anything in the public, you're probably going to get secret shopped at some point. The 4 pages that I have built for you, I have done my best to keep this 100% compliant. You'll see little things in there like maximum out of pocket, right? We covered that on page 3. How an HMO and PPO works, cover that on page 1. There's 26 different things that you have to do on a compliant presentation, and pages 1 through 4 covers 25 of those. So if you follow these steps, if you get really good at pages 1 through 4, you're going to do a great job getting out there and selling, especially if you do it face-to-face. Now, this stuff is effective for telesales or Zoom calls and everything else. But I do recommend that whatever you do, get yourself the downloaded version of all 4 pages and have a copy for every client. And then regardless if you do it in person or if you do it over the phone, you're going to have to get their email anyway. Send them a copy of this information. I'm telling you, this will go a world beyond what any other agent will want to do with them, and it will keep them your client for life. And that's really the goal with Medicare. Okay. All right, guys, we have hit our time. So I'm going to say thank you. If you guys have a need for those 4 pages, please go ahead and just shoot me an email, and anything else, either call or text. Until next time, have a good one.
Thanks, Carl. They
Thank
are
you
in
so
the back
much.
office. Those pages are in the back office, by the way.
Perfect. Thanks, Glenn.
Thank